How is the mental health situation amongst NHS staff at the minute, amongst nurses at the moment?
It's never been brilliant, Patrick. It's never been brilliant. And people will say the pandemic and the striking has made it worse. But actually, it was going on prior to this as well. It just wasn't as publicised as what it was before and not talked about as much. There's a stigma in the NHS, I think, about mental health. And how do you say to somebody, I have mental health issues while trying to protect patients as well? I think there's that worry from people. I
think some people would say, well, look, when you sign up to a job that is involving life and death and everything in between, a lot of that pretty grim, one would imagine, very long hours, very stressful, that a knock-on effect of that will be potentially, you suffering with your mental health. And do you think it's reasonable to expect that, nurses should just deal with that?
No, I couldn't even say. I've had mental health issues. I remember when I qualified 3 years ago, moved to a new practice, had things going on, and it was really hard to deal with. And if someone said to me at that point, well, you're a nurse, it's expected, you've got to get on with it, I probably would have broke. Fortunately, I sought the help that I needed and got where I am today. But no, definitely not. This profession isn't going in and going, right, OK, I could end up with mental health issues. I've got to deal with that as a nurse because that's what's expected.
Yeah, exactly. And I think that is absolutely fair enough. The burning question for me now is, does a pay rise help with mental health?
So what you've got to look at is the aspects of why the pay rise is being asked and why we're looking at conditions within the nursing career. Then, yeah, it will have a positive impact towards mental health as well. And we can't blame those striking for an increase of mental health within the NHS. I don't think it's fair to put that on others as well.
So by that you mean that because people striking will increase the burden on other areas of the NHS, which might make some other people suffer mental health-wise, we shouldn't blame those people striking for making their colleagues' mental health worse?
Yeah, mental health has always been here, Patrick. It's always been there, whether we've been striking or not. There's been risks of mental health. Adam Kay's book documents a trainee GP killed themselves. They committed suicide. This was before any strikes or anything, so it's always been there. It's not been out in public knowledge as much.